So talk about a very important test. Um, this is like mostly towards microbiology. So it's a test that will actually help you to be able to, dictate antibodies. All right. So it's just all those tests in the lab and all of that help us to now know about disease conditions and all of that. So for the Coombs test, of course, we have the direct Coombs test, we have the indirect Coombs test, which will basically talk about all of them. So for the Coombs test, is also known as what? Antiglobulin test. All right, it's a diagnostic test. It's used to dictate antibodies, all right, that act against red blood cells. So it's important in diagnosing some disease conditions, which will be listing the disease conditions. All right. So these antibodies can cause your immune system to mistakenly destroy your red blood cells. Okay. So leading to hemolytic anemia. Also, there's complications in pregnancy and transfusion. So on the girl's voices as a gynecological channel, that's why we are looking at it, because it can cause complications in pregnancy. All right. So the Coombs test, we have the direct one, which dictates antibodies or complement proteins attached to red blood cells directly. The indirect one dictates what? The free floating antibodies in the serum that may later bind to the red blood cells but have not bound yet. You get the two differences now. So how does it work? Direct test, red blood cells are washed, mixed with the Coombs reagent, that's antihuman globulin. If antibodies are present on the red blood cells, they agglutinate, they clump together, indicating that there's a positive result. Indirect one, serum is incubated with donor red RBCs and Coombs reagent. Agglutination suggests the presence of antibodies that could cause transfusion reaction or fetal complications. They're just floating. So these ones, they could actually cause some one or two issues later on. So this is it. This should be the direct one, antihuman globulin. So clinical uses can be used to dictate autoimmune hemolytic anemia, can be used to dictate hemolytic disease of newborn. That's the main reason, Transfusion reactions, prenatal screening, all right, for rhesus sensitization. Of course, like if you see a positive test, you might actually want to screen, if there's a rhesus factor incompatibility and all of that, okay? So if there's a positive test, it shows that antibodies are bound to what? The red blood cells. All right, that's the positive direct test. Then the positive indirect, it shows that there's antibodies and they are freely floating in serum. All right, if it is negative, there's no antibodies at all.